Channel 5 News, the team that's first on the scene.
Hello and good evening and welcome to Fox 5 News. My name is Taylor Freeman and I'll be bringing your latest updates. This morning we received information about a polio outbreak in Roslyn High School, June 8th, 2015, and we are here to bring you the latest updates on what can be done to prevent the spread of this disease. For starters, we're going to give you a bunch of information about the disease, such as its mode of transmission, its origin, its symptoms, and its diagnosis. To a normal person, it might be known as polio, but to a scientist, the actual name is poliomyelitis, and this is a type of virus. It can be transmitted through person-to-person contact, however, only in humans, so don't worry because your dogs cannot catch it. But be careful because the virus can transmit before you develop symptoms. Symptoms may include fever, sore throat, headaches, and muscle stiffness. There are actually two types of the virus. There is non-paralytic and paralytic. The non-paralytic consists of symptoms that I mentioned previously. However, the paralytic consists of these symptoms only for a week, and then one develops severe muscle aches, spasms, loss of reflexes, and unfortunately, flaccid paralysis begins to develop. This may occur very, very quickly, and it only may occur on one side of the body. Here you see we have a young boy suffering from paralysis in the legs. Here we see a young girl also suffering from paralysis in the legs. As you can see, the effects of this disease are quite heartbreaking. Here is an image of a young girl in India who has lost all function of her legs. Only a small amount, approximately 2 to 5% of children can die from this disease, while a larger amount, 15 to 30% of adults, may die. In 1988, there was 350,000 known cases of polio. However, this has dramatically decreased about 99% to 416 new cases in 2013. This is why it is quite alarming to us, the number of cases found in Roslyn High School this day. So first of all, you might be diagnosed by your past medical history or physical examination. If you have muscle stiffness, difficulty with limb movements, or difficulty swallowing, this may be the preliminary diagnosis. However, a definitive diagnosis may be made by cultivating a poliovirus from a patient's mucus and/or stool. For those patients diagnosed with non-paralytic polio, the prognosis is usually good and many recover with no complications. Those who suffer with paralytic polio may have a good or a poor prognosis. Some can be disabled for the rest of their lives, and some may even die. As you age, your nervous system may become less able to compensate for the damage that polio caused, so symptoms may gradually appear. This is known as post-polio syndrome. Now you may be asking yourself, what will now happen if I become infected with the disease? Well, there is treatment and care. However, no drug can kill the virus once you're infected, so the treatment is used just to control the symptoms. In minor cases, such as non-paralytic polio, bed rest and over-the-counter medications can control the fever and muscular pains. There's also physical therapy and the using of catheters to prevent urinary tract infections. Here is an image of a young boy receiving medicine as treatment. In present times, there is actually a polio vaccine that is 99% effective. You get this shot in 4 doses, one when you're 2 months old, 4 months old, 6 to 18 months old, and 4 to 6 years old. Here is an image of a young boy actually receiving the polio vaccine. Here is an actual baby picture of me crying after receiving my first polio vaccine. To conclude this segment, if you are feeling any of the symptoms previously mentioned, please contact your doctor as soon as possible. That is all the news we have for today. Cannot wait to catch you later. Stay safe and stay healthy.